Is it possible that your back is causing your hip pain? This is super common. Step 1, check your hip. You can cross your leg. You can cross your leg while you're lying on your back, kind of bounce around on it a little bit. Just kind of assess symptoms. Then you can do a muscle test. Just put some pressure on that knee to make your hip muscle work. Step 2, let's move your back. Make sure that your feet are directly underneath your hips. And try to avoid allowing your hips to just shear forward. You want to make sure that you're actually bending from your back as opposed to just shifting your hips forward. Nice and smooth and controlled. Here's a different angle. You want to make sure that those back bones extend. For step 3, we're going to recheck the hip. We want to make sure we do the same tests. We want to be very consistent. So you have your 2 cross leg tests. Then you can do your muscle test. All right, let's pause for a moment. We have to ask ourselves, are we better, same, or worse? And the answer to that should be pretty obvious. We're looking for a relationship between the back and the hip. Now here's the breakdown. This could be a 100% back problem and a 0% hip problem, in which case you need to treat the back in order to change the hip symptoms. Or it could be an 80-20 problem, in which case you treat both. Or it could be that it's 0% back and it really is just a 100% hip problem, in which case you just need to focus on the hip exclusively. If there was no change from the first exercise, try this. Lie on your stomach, toes in, heels away, relax your glutes, put your hands underneath your shoulders, and just extend your back. If you start feeling the pain move locations from your leg up into your back, that is actually a good thing. That's called centralization. We want to continue with this movement. If you find that this movement causes pain to run down your leg and makes you worse, I definitely urge you to stop. This might not be the movement for you. Keep in mind that over 70% of people who have hip pain actually have a component or the entirety of the problem coming from the low back. This is why it's important to explore your lumbar spine when you have a hip problem. Finally, let's recheck that hip with the same tests you did before. We want to be consistent. We want to see if there's a relationship between the low back and the hip. My name is Dr. Chris, and I hope you found this video helpful. If so, please like, comment, subscribe, or follow, because I'm here to help you. Always remember that there is a solution to your problem. If you have yet to find one, you can call, text, or email me. I would love to help you out.